For my oral care on an unconscious patient skill, the first thing you want to do before entering the room is knock on the resident's door. Once you have entered the room, you then will introduce yourself, greet the patient, and explain to them what you will be doing and what to expect. After you have introduced yourself, you then perform your proper hand hygiene and you provide privacy for the curtains. Next, you will need to raise the bed rails to adjust the height of the bed. You do not want to be on your tippy toes and you do not want to be bending over to reach the patient. After you have raised the bed to an appropriate height, you may only lower the bed rail that is nearest to you. After you have lowered that bed rail, you then apply disposable gloves and you position the patient so that they are laying on their side facing you, and you also need to make sure that their head is in the appropriate position. After that, you will then place a towel underneath the patient's cheek, and you will also place a kidney basin underneath their chin. After you've done that, you will then take a swab, which this will be representing my swab, and you swab the inner part of the teeth and the part that they chew on, the chewing part. And then once you have done that, you throw that away. You do not use that swab to clean other parts of the mouth. You throw that away. Take a new swab, clean their cheeks, the roof of their mouth, tongue, and lips if they need their lips cleaned. Throw that away. Next, with a swab that only has water on it, you take and you rinse everything off. After you have done that, you throw that away. You then apply moisturizer or some kind of chapstick to the patient's lips. After you've done that, you want to take the towel and make sure they don't have any excess water, mouthwash, stuff like that on there. You want to make sure the patient is all cleaned, and you need to clean up your mess. So the towel will go in the appropriate bin. All your cotton swabs should have been thrown away, discarded properly. You then move the basin, discard of that properly. After you have done that, you will need to remove your gloves, and then you will need to reposition the patient so that the patient is comfortable. After you have done that, after you have repositioned the patient and thrown all your stuff away, you will then raise both bed rails back up and lower the bed so that the patient will be comfortable. After you have lowered the bed rails, or the bed, you can then lower the bed rails, and you need to place the call light near the patient. After the call light has been placed near the patient, you then need to perform your proper hand hygiene and report and record.